per kilogram of body weight that it would be. That is recommended in patients who have kidney disease. So a little bit below a gram per kilogram is what is recommended to slow down the progression of kidney disease. And then when looking at which protein to do, we talked about doing more plant-based proteins and less animal-based proteins, and focusing more on the plant-based proteins. But some of the other animal-based proteins, as listed here, as you can see, and the amount of protein as well. So more beans, legumes, nuts, and seeds. Even whole grains have the proteins, and some starchy vegetables as well have. And then obviously in animal-based proteins, it's meat, poultry, fish, seafood, eggs, and dairy, milk, yogurt. Any of the dairy things have protein as well. It is not recommended anymore to go on low or very low protein diet. So not going on anything below 0.6 or 0.5 milligram per kilogram, because then you get depleted in essential amino acids and other amino acids if you go on a very low protein diet as well. We won't go into the pediatrics as much, but in older adults, so in people who are much older, there's a high risk of having frailty and sarcopenia, and those might need a higher protein diet and might not be recommended of even doing 0.7 or 0.8 milligram per kilogram of diet. So it would be worthwhile, again, to meet a dietitian and kind of go over into details of what your personal needs of the protein would be. I guess one of the second most important thing is sodium, and I think this is for mostly everybody who has kidney disease, that it is recommended to go below about 2 grams of sodium per day, which comes about to less than 5 grams of salt, which is sodium chloride. So if you're looking at the salt, that would be less than 5 grams. If you're just looking at the sodium, less than 2 grams. There are only very few people who would not be, but for almost everybody who has kidney disease, it is recommended to go below that, which is one of the hardest thing to do as well, because everything that we eat has sometimes salt already added to it. And then I'm not going to go into pediatric, but if for pediatrics, it's different based on their age. And I think that is kind of all I had for when we are talking about different things. Obviously, as the kidney disease kind of gets worse, we have other limitations that happen too, with your potassium, phosphorus, and some other things that you would have to change in your diet. But these are the main things that is recommended at this point of time. Okay, so hopefully this was helpful, and then we will now kind of take some questions, and I'll let Tony kind of take over. I know Megan is here. Hi, Megan. Nice to see you. Oh, okay.
Okay, so did you want me to ask one of the questions that we have from?
Yeah.
Okay, we'll just go ahead and start on some questions then. So one of the questions was saying, is there a specific diet that can be helpful to try to follow? And I know you already went over diet, but that was one of the questions that they had. Or even, go ahead.
I guess kidney diet is a special diet, I would say, which is not easy to follow. So kidney diet would be the diet that would be recommended if you have kidney disease. But like I said, it's a very broad diet, and so it depends on what type of kidney disease you have, at what level you are. So sometimes you don't need to follow exactly the whole kidney diet for somebody who's on dialysis. So having and that's where individualizing the diet for you would be very helpful, rather than having to limit everything for the kidney diet.
Okay.
But it is, sorry, Tony, but yes, it is an important part of managing kidney disease. I would say diet is a very important part, because kidneys kind of get rid of what you have, kind of things that you put in your body. So getting the right diet and making it easier for the kidneys if you have kidney disease definitely helps in prolonging the life of your kidneys, or keeping the kidneys healthy and working for longer. So one of the it's, if not as, probably even more important sometimes than the medications, is what I say, to follow that diet, which again is easy. Yeah.
Okay. And there was another a question that came up was, will you discuss some tips on, it says Indian vegetarian diet as well, or maybe just vegetarian diet in general?
Yeah, I think that's a great question about because I think there's a lot more data recently into having more plant-based diet. Again, like I said, when I was saying that um, you don't have to become vegetarian if you're not a vegetarian, but being a vegetarian and in having more plant-based foods in your in your diet definitely helps. I don't know if Megan can chime in because I think she'll probably be a good resource, but I don't know if she is not able to talk, but I guess we are working on the tech part of it to be able for her to be joining. But I can kind of try to get to that question in the best I can, not being a dietitian. So, but obviously seeing people with kidney disease for many years now. So again, more plant-based diet, and so eating more plant-based proteins because you really want to make sure you have some plant-based protein. Yoo-hoo, Megan, for the rescue. Awesome, Megan.
Hello.
Hi. I guess the question, Megan, well, welcome.
Yes.
And thank you for being here for this morning and part of it, being a part of this. I think one of the questions, Tony, do you want to rephrase it to Megan or ask Megan again?
Yeah. So the actual question was talking, will you discuss some tips on Indian vegetarian diet? Or if you can't answer that, just in general, vegetarian diet, how beneficial it is to the kidneys, or is it your input on that?
Oh, I think we lost your audio again. Oh, you can't hear it either? Okay. I think she's still trying to get the audio, but again, eating more, when we're talking about vegetarian, like eating more beans, and that has a lot of protein in there, eating less processed food. When you're talking about vegetarian, it's one of the important things to think about is not those processed kind of meat alternatives. That's not probably a healthy thing because they're very processed food. So staying away from that really helps. So when you're thinking vegetarians, just adding more vegetables and fruits to your plate, and making beans or tofu or that an important part as well of your diet probably, and kind of staying away from those processed meat alternatives like that come all the time when you go to the grocery store. They're everywhere. So
Okay. So another question just pop up. It says not just vegetarian, but vegan. Is there a difference?
Yeah, so vegetarian, I guess, involves just cutting out the meat, and vegan is no animal-based products. So I guess in vegetarian, people still can have dairy. Again, dairy, limiting dairy in kidney disease is recommended more so in later parts of the kidney disease. So because that has a lot of phosphorus in it, which if you have advanced kidney disease can be is not recommended as well. So again, you don't, like I keep saying, you don't have to become a vegetarian or vegan for if you have kidney disease, but just increasing the amount of that. Is vegan diet better than vegetarian diet? Obviously, whatever you can follow. Again, it's not that you have to completely stop animal-based foods, but just increasing more plant-based foods is recommended would be the main thing.
Right. And another question that came in was, can we drink occasional wine or alcohol, or is it damaging to the kidneys or not?
I think anything in moderation and once in a while, if you are celebrating or if you're going out and it's having a good time, so having that in moderation is acceptable, but that it's not like you're having a party every day or a couple times a week, then it's not moderation. So anything in moderation is acceptable. It's not that you have to completely stop, but again, once in a while, like your birthday or your anniversary, if you have a glass of wine, that's totally acceptable with kidney disease, I would say.
Right. Okay. So I guess Megan is trying to join.
I know.
Still. Okay. So here's another question. It says, New question. Please tell me about fasting. I'm Muslim, so it's required to fast in the month of their Ramadan during the whole day. Does not eat anything around 14 to 16 hours. So, what are your thoughts on that as far as fasting? I know people do intermittent fasting also. How does that affect the kidneys?
Yeah, I think Megan is here. Megan, do you want to take that one if you could hear it?
All right. Can you hear me this time?
Yes.
Yeah.
Oh, okay, great. Thank you. Finally. All right. Can you just repeat the question for me?
Okay, this question was about fasting. What are your thoughts on fasting 14 to 16 hours if they have based off their religious beliefs and just in general? I know some people do intermittent fasting. What are your thoughts on that?
Yeah, there's definitely pros and cons to intermittent fasting. And, I'm not going to ever tell anybody not to do that for their cultural practices. Usually I only just kind of talk to things to watch out for. And it would really be for if anyone has diabetes, is watching, your blood sugars through the fast. And if you're finding that you're going low, what can you do to prevent that? And so it's really about managing your diabetes would be my biggest concern there.
Okay. I don't have any more questions at the time.
Megan, I think one of the questions now that we have you here, a lot of like vegetarian or a vegan, what would you recommend if somebody wants to follow a vegetarian diet? Yeah.
Yeah, I think, just starting with going towards being vegetarian is a great start and getting a lot of just those plant-based proteins in. And so you're looking at like the nuts, the beans, the seeds, tofu, seitan, tempeh, those things if you're open to them. And then, you can even take it further and then look at the dairy products and go towards more being vegan and cutting out the dairy, the eggs, those things. And that oftentimes will just is helpful if we have to manage our potassium or our phosphorus down the line, then that's just one more step.
Okay. I think we lost you there just for a minute, but I think we have you back.
I think I'm back.
Yeah, you're back.
Yeah, okay.
And then when we're going to plan, oh, sorry, go ahead. Were you saying something?
No, I was just going to kind of re-summarize is that like, it's, okay to do it in steps and not be going from, 0 to 100% the next day. And, any little bit of change that you can do is really helpful to your kidneys. So even if it's just incorporating a couple of plant-based protein-based meals throughout the week, that's just really great for our kidneys.
And I know you went over some of the plant-based proteins, but I know there are so many plant-based proteins when you go to the grocery store that there are like those alternatives. And so how do you kind of go around when you are like going into the grocery? Like some have a lot of salts added because they're already made or like processed, or they become like ultra processed or processed food. So it's kind of
yeah, yeah, I mean, a lot like, right, you could go and get a Beyond Burger from like the freezer section, and those could definitely be more processed and have the additives and things that we're trying to get away from. So I really try to bring people back around to those whole foods, those nuts, the grains, the seeds, the beans, because those ones are like our natural whole foods. They're going to be easier on our kidneys. They don't have all the additives. And so we absorb less of the natural nutrients from those into our body. And so it's just so much easier on our kidneys versus those processed things. So it's definitely still looking at your nutrition labels when you're picking out the plant-based proteins too, because we can still get a lot of additives and other things we don't want in certain ones. So yeah, still reading the nutrition labels and looking at it.
Great. And then I know, because you're here, we have all the questions that sometimes my patients ask, and I know I can send them to you. But how do you cut the salt? I think this is like one of the major things for every patient who have kidney disease, like how to go about. Do you have like a kind of like approach where you tell patients like how it's one of the hardest thing, I guess? Yeah.
Yeah, it's definitely really challenging. First thing is to just put the salt shaker away that might be out on the table, put it back in the cupboard, and then it's not, trying to not salt at all when you sit down and your food's ready to eat. If you're someone who's a heavy salter, and maybe that's a really tough change, it's just slowly salting less and less until you can get away from it. The second thing that is when I work through lowering salt, the second thing would be just trying to eliminate salt in recipes. So majority of recipes, you can just omit that salt out and it's just fine. Baking you can't do, so don't do it there, but definitely in our cooking recipes. And then we, say, let's look at the nutrition label, let's look at how much sodium is in our products, and then really trying to find those high salt foods that we can work on limiting. And so that would be a lot of your processed meats, so bacon, sausage, lunch meats, dairy products, and so a lot of condiments, convenience foods. So then we start looking at that layer and how can we adjust things there. Mm-hmm.
Nice. And then is there like, I know we say 2 grams, like how do you, is it like just trying to go lower and lower? Is that what it is? Can you go too low sometimes? Does that ever happen? Or is it like people don't have to worry about it because there's so much salt around us already? Is that would ever be?
Yeah, I mean, you could definitely go too low because we do need some salt in our bodies to function, right? So, if you're going below 1,000 milligrams, I would start to be concerned. I really find it hard though for people to truly get below 1,000. Even 1,500, I think, is a really big challenge. And so one of my favorite things to tell people is that if it feels easy to be at 1,500 or lower, I don't know that it's going quite. I don't know that you're doing it quite right. So just to bring things into perspective on how difficult it is.
And how do you know how low you're going? Is there something that they can like, or what they're eating? Is there something, and I can chime in that too, but I know it's something how people can follow, or how do they know rather than exactly measuring? Because it gets, obviously you keep an eye on that, right? How much you're eating, but is there a way
Yeah. Yep. Generally, the more fresh you can go, you typically have lower amounts of sodium there. So, if you're doing those great fruits, veggies, you're going to get very low amounts of sodium there. But yeah, it is kind of roughly kind of watching, what you're taking in. There's definitely different ways. Some people like to track by apps, and, you can track for a day or two just to get an idea where you're at, and then you kind of modify, but not something that anyone needs to track all the time, but it's nice to just get an idea where you're at. And maybe if you're at 3,000 in a day, you can say, okay, I'm going to get down to 2,500, and then you get comfortable there, and then you keep go down to 2,000. And but yeah, general rule of thumb is the more fresh you can go, the lower in salt you're going to take in.
Nice. And how long does it take to get used to the taste? That's like the most common question I get, right? Because it tastes bland. So how long does it take? Is there like something? How long? That's a hard one though.
Yeah, I think that's different for every person. It probably takes, a couple weeks or more. But once you get used to it after a while, I definitely, people tell me how quickly, if they have something salty, they can tell how much salt is in there now. So once you get used to it, going back is the bigger change. But yeah, it probably takes at least a couple weeks, maybe longer, depending on, where you're at, where you started. If you're someone who you've always kind of your whole life used a lot of salt, that might just take a longer change versus someone who maybe has always used minimal salt their entire lives.
Yeah, great point. And just adding on to that, sometimes we can do a 24-hour urine and you can see how much salt you're excreting in 24 hours. I know it's a cumbersome test to do a 24-hour urine, but if you're really motivated, that can tell you how much salt you're eating, because what you're eating, kind of what you're excreting if you're on like a steady diet. But obviously when you start doing 24 hours, sometimes it's hard because you change your diet a little bit because you're measuring, but at least it gives you a little bit as to sometimes also, or like an app would be a great idea, like Megan mentioned, to track sometimes, because it's like hard, like how much you're taking, eating. Yeah.
Mm-hmm.
Tony, did you have other questions, or I can keep going and asking Megan?
Oh, well, there was another Facebook question, but the person was asking about fasting. So I'm going to try to like rephrase this because this is about fasting 14 to 16 hours. Did you already answer that one? Yeah, you did,
Yeah,
right?
I think I did. Yeah.
Okay.
Yeah.
And then, yeah, go ahead, Tony.
No, go ahead. Go ahead.
No, if you have questions in between, you can chime in
Okay.
too. But how much water to drink, Megan? That's also one of the questions people ask. How much water should I drink? Yeah.
Yeah, unless you're being advised to follow a fluid restriction, usually it's getting in lots of good fluids throughout the day and trying to make a good chunk of your fluids come from water. But of course, you can have a few other things in there, but usually like 60 to 80% of your fluid intake should be water. But yeah, usually, plenty of fluids. I don't know that there's necessarily a number, but definitely, at least 64 ounces or more, and then kind of watching from there. Mm-hmm.
Perfect. And then potassium. I know we haven't gone into potassium, but I guess not everybody needs to restrict it, right?
Yep. Yeah. Our guidelines, at least here in the United States, have really gone away from even giving a range on how much to take in each day. And it really comes down to just keeping your potassium levels in the body normal. So, one person could be taking in a lot of potassium, and if their level is great, that works for them. Whereas other people might have to take in a lot lower to keep their potassium normal. So that's really what we look for, is just what our levels in the body and keeping those where we want them.
And I guess the same goes for phosphorus too, when we are limiting the phosphorus in the diet, or like how much phosphorus.
Yep.
Yeah. It's keeping.
Yeah, exactly.
Just keeping the numbers. And so following up with your doctor and getting those checked and seeing if they're going high, then you start restricting them. Otherwise, you don't need to.
Yeah. Yep, yeah, because otherwise, you can end up becoming so restricted in what you're eating, and then it feels like you're being restricted from things that, we grew up being told these are really great for us. So, and then, for anyone who does have to watch their potassium or their phosphorus, again, it's kind of like sodium. There's layers in which we can start and work through so that we're going through it and being the least restrictive. And then it's not always that we can't have anything. I often hear, I don't eat bananas anymore for the potassium, but it's really about modifying the amount or the frequency that we're having something. So if somebody has a banana every day, then I just talk about, well, let's have a banana 3 times a week and see where things are. And we modify that way so that no one ever feels like they can't ever have something again.
And there's another Facebook question that just came up. Is there a minimum amount of sodium?
Yeah, I think we kind of talked about that a little bit, but it's probably not going below 1,000 milligrams, but it's pretty difficult to do that. So I don't think I see many people actually get under that.
Right. So I guess sodium is the key here, is to watch our sodium intake, right? Or for patients to watch that. Yeah.
Mm-hmm.
And Megan, do you know how to see a dietitian? I think some of the people don't even know. I know they see the kidney doctor and they're like, oh, you should cut down the sodium. And then you're like, what does that really mean? So the kidney doctor can only talk for a little while, but it's really hard.
Mm-hmm.
Like if somebody tells you, you've been told by your kidney doctor, decrease the sodium in your diet, like how can they incorporate, like what are the resources that they would have or can reach out to be able to make it happen?
Yeah, I mean, I think I would first just like encourage everyone to see if like wherever they're seeing their doctor, is there a dietitian on staff? And it is kind of asking like, can I see a dietitian? If there isn't like a kidney specific dietitian available wherever you're seeing your doctor, then, you know, the slides that you showed about searching for a dietitian are great. A lot of those dietitians, from what I've looked through, are like private practice dietitians. So they're still really great. They're really knowledgeable. It would just be a matter of whether your insurance, you know, that coverage piece works, so that they would have to take a look at. But I think it is really advocating of like, can I see a dietitian? Can I get a referral? And I think that's just an area where we're always trying to improve that access.
And then are there some resources that you give to your patients, like online or some of, I know I mentioned about the National Kidney Foundation nutrition coach, but is there something else that people can look to get more if dietitian, let's say, is not available or even later on, because it's a one-time visit, right? So it's hard.
Yeah, yep. I mean, the National Kidney Foundation is a great resource. I also always tell people, go check out DaVita, go check out Fresenius's websites, because they do tons and tons of recipes. And so sometimes that's really helpful. They also give tons of information. So those are still great to look at. And then, you know, I'll give out resources for like plant-based books. So Forks Over Knives is a really nice one. That's a good one to look at. But yeah, some of those big organizations like the National Kidney Foundation is probably the biggest one that I tell people to go check out.
Okay.
Megan, so it's different, right? When people have like chronic kidney disease and then they go into dialysis and their diet just totally changes. Well, they have to restrict, you know, potassium and phosphorus in their diet. And then after transplant, it changes again. Right. So it's a real struggle for patients sometimes. Okay, they go from one thing then to the other.
Yeah, I do give some of that information to patients if I'm seeing them and they are close to starting dialysis. I'll let them know some things are going to swing on you. Like you might have to start restricting fluids. You know, you're no longer maybe restricting protein. You're now going to be asked to eat lots of protein, because sometimes those swings are hard when you change and suddenly you're like, but you told me, you know, to drink all this fluid and now I have to stop. And so I try to, give that out a little bit ahead of time so that it's a little bit easier to process and get used to. The fun part is talking about, you know, after transplant, when we can, when we hope to get a little bit more liberal, and usually we can. Sometimes the first few weeks after transplant, we're still monitoring potassium, we're still monitoring a few things, but slowly over time, we can start getting more things back in. So that part's fun, when you can definitely be like, okay, we don't need to worry so much about these things.
Right. So much about drinking soda or dark colas, and now you can. Or even chocolate.
We definitely still want people to follow a healthy diet after transplant. You know, a lot of the medications that people are on can often cause weight gain after transplant. So we do still target, you know, following just a well-balanced, healthy diet after.
That's true. True.
I guess one of the, I'm thinking what other questions, but I know with you, we had previously talked about protein or how much protein, but since we didn't talk about how much protein. We talked about how much sodium, but how much protein to take. We talked about plant-based protein being more and less animal-based protein, but how much of protein should you eat in a day, I guess, with kidney disease?
Yeah, and I think you had it on the slides earlier. Yeah, kind of, you know, there's different recommendations that you can come across from the United States to globally. I think in the United States, we tend to run them a little bit lower, but kind of that 0.6 grams per kilogram for anyone without diabetes. For anyone with diabetes, we usually recommend about 0.8, and we do that just because the little bit higher protein helps manage our blood sugars. So it's really needed for that stability. There's definitely options to go lower, but we usually tend to not recommend those because usually if we're going really low in protein, then we are jeopardizing our muscle mass and potentially weight loss and being at risk for malnutrition. So we do want to be really careful. And, if anyone is going really low in protein, we would want to be, monitor with your dietitian and your doctor pretty closely on that.
Mm-hmm. Nice. And then when we talked about plant-based protein, but in animal-based protein, is there any specific when people are asking which ones to avoid in animal-based protein and which one to take? Is there any specific one?
Yeah. So this will come more towards heart health, but if you're thinking about, pork products and beef products, those ones are our saturated fats. So they're hardest on our heart and our blood vessels. So then, if you're going to choose animal products, I encourage the lean protein. So this would be, your chicken, turkey, fish, those ones. And then going towards the plant-based, which would be your unsaturated fats. And those ones are the healthiest for us too. So unsaturated healthy fats are nuts, beans, seeds, avocados, olive oil instead of butter, that stuff.
I see. And I was gonna ask, and then it let's see. Any other questions that people ask you in the clinic when you see them? Like anything that comes up a lot when you see people? Yeah.
It's definitely the question about which animal proteins are better. So kind of talking about that lean versus the saturated. Usually I think also the big thing is just talking about that a lot of people restrict their potassium and their phosphorus and they don't need to, and they're already doing it because they've just seen a lot of information online. And so a lot of times I help people pull things back into their diet to kind of help be less restrictive with still managing things. I think those are some of the big things that I see.
Mm-hmm. Yeah.
So it seems like, do they get some misinformation online and they're just pulling it out of their diet without even knowing? Have to redirect them back. Yeah, that's kind of interesting.
Tough because online just gives so much information, but it's not specific to, each and every individual. So a lot of times the stuff online just tells you to eliminate everything because it doesn't know your labs. And so then, I'm like, oh, well, actually you've never had any concern with your potassium or your phosphorus to start. So let's pull some of these back in so that you can have these healthy, great foods in your diet and you feel like you have more options.
Interesting. Yeah, good point there. So I guess it would be helpful for people to get a hold of a dietitian. Their kidney disease. Yeah. What are your thoughts on people that go gluten-free?
For anyone with celiac disease, definitely should be following that. That's really important. If it's a sensitivity and you feel better, absolutely. I think it's definitely really manageable. Gluten-free over the last decade has become far easier to do. There's, just more availability of things, but, it just, in the end, I think is okay. If it just depends on whether you're willing to learn to cook with other grains and different things. So,
right. Okay. Because I had realized also, Megan, that a lot of gluten-free products out there, like even the bread, has a little bit more higher sodium than normal bread type of thing, right?
Yeah, breads in general are one that, you know, they can get high in sodium pretty quickly. You know, if you can make them homemade, that's really helpful to cut out a lot of salt. But otherwise, yeah, it's really piecing through those nutrition labels. And there's, you know, a handful of brands out there that do a better job than some others. And
Yeah.
that's, you know, when my patients come to see me, I tell them, you know, if you're struggling to find a brand that fits what you need, let me know, because I can quickly get them what brands do I recommend. And so I try to market myself as that's one of the most helpful things I can do, is I can be like, switch to this brand, do this one, because I just have them all ready to go already. And it really stops patients from having to spend so many hours at the grocery store, or really that time of having to do it all themselves.
That's nice. Yeah.
I guess supplements is one of the other things that I get asked a lot. Is there any, like, when I'm talking about supplements, there's obviously like those protein bars and protein supplements, or one is that part. And is that something that should be done or shouldn't be done, or what would you recommend? And there are definitely different types of protein bars and protein supplements.
Yeah. You know, when we're trying to not do too much protein, a lot of times I don't recommend them when we're not on dialysis. But it kind of depends on the situation too. If somebody's, you know, struggling to eat, or they're just not getting a lot of protein in, and they're well below those, that 0.6 or that 0.8, and it's a, you know, way to help them get that, then we use them. You know, we have a lot of renal friendly supplements out there. A lot of them are pretty high in protein because they're more targeted for patients on dialysis. And so it just kind of comes back into taking into account, like, how are they eating? I'll do like a quick kind of count of how much protein do I think someone's taking in. And then I could say, okay, let's focus on these supplements if we want more, or you're getting plenty of protein, you probably don't need a supplement. And then, you know, it's not that it has to be renal friendly either. So that's kind of the other side of things, is that, you know, if somebody isn't eating well and their potassium or their phosphorus is low, we can definitely jump outside of the box and, you know, grab supplements that aren't geared towards renal patients, because they're probably not going to push some of those labs high anyways. And so it ends up being okay.
And then obviously we are focusing a lot of like kidney disease where GFR is below 60, but there are some people who lose a lot of protein with their, let's say, if they have glomerular diseases like FSGS or minimal change. And then I recommend them to kind of supplement more protein because their albumin level is really low. Like their albumin can go below 2 because they're losing so much of protein. So it is recommended for them to eat more protein, or at least replete the amount of protein that you lost in the urine, a similar one. So I know we are focusing a lot on that 0.6, but that's mostly for patients who have GFR less than 60, and you could have a combination, right? Is that kind of?
Yeah, yep. And, you know, too, with, you know, what I also talk about with looking at albumin is, you know, if we're not eating well, we definitely can, you know, eat more protein to help that. But sometimes too, like things like inflammation, infections, high blood sugars, those things can definitely affect our albumin too. So a lot of times it's kind of looking at it in a lot of different ways and hitting the protein and then hitting the other things too to help with that.
And then just albumin is a specific type of protein in the blood that we check with the blood test. So your kidney doctor would check a protein level in the blood, and that would be that albumin. And if it is low, then it would be, again, discussing with them how much protein you should be taking with the kidney disease. Perfect. And I think those are kind of the most of the questions that I could think of or that patients ask with the kidney diseases. But yeah, again, thank you so much for being here today. And answering all your questions. It's super hard for me because I have kind of you in the clinic, so I just send people. But I would totally encourage, if you can find a dietitian, it is so helpful to meet. They kind of go over your diet, your personalized diet, what you eat, and they kind of suggest what you can change, because it can be very overwhelming when you first look at kidney diet, because there's so many restrictions. And like Megan has been saying, you might not need everything. And that's what I tell people. It's like, you might not need all the restrictions. So what you need right now is do those. And yes, if the kidneys do get worse, you might need more restrictions. So it's not like a one-time thing diet too. I think it changes. And so it's worthwhile to talk to your doctor every time you see them, at least briefly, if there's something change in your blood test or urine test, that if you want to have anything change in your diet as well. And if they're bigger changes, then usually have a dietitian see them again, or usually the dietitian might see them once. It's not like a one-time thing either, right, Megan, when you see them, your patients?
Yeah, it just depends on, where they're at, how things are going. But I definitely do follow-ups with patients all the time. And it can be a range of anywhere from 3 months to 6 months or annually. And so, yeah, definitely follow patients. Mm-hmm.
And then obviously here in United States, if you go on dialysis, you will have a dietitian in a dialysis unit, right? That you would probably see, if not monthly, but every couple months probably, that they'll come by and talk to you and go over the labs, right?
Yep, and it's definitely monthly. And even a lot of times in units, it's more. So, but definitely at minimum monthly.
The dialysis unit, right? Yeah. And they go over the labs and recommend and kind of go over the diet, what not to eat, what did you eat this month, kind of thing, right?
Yep. Yeah.
Perfect. Again, thank you so much, Megan. This was super helpful, and hopefully a lot of people
Thank you for having me.
No,
sorry it took me so long to get on.
No worries. I know it's the tech, right? It's always something goes on with the tech. But I heard your baby crying in the back too. So hopefully you have a nice rest of your day. And again, thank you for taking out the hour to talk to us today.
Yeah, you're welcome.
Thank you, Megan.
Bye-bye.
Bye.